to the health protocols. Together, we can win the fight against COVID-19. Thank you.
Thank you. So what I'm going to do is I'm going to ask Eugene to do the presentation to our Chief Director of Ministry, Mrs. Andrews. So, Mrs. Andrews, please step forward and receive it on behalf of the Ministry. Okay, you have a... Okay, very well. Then we'll use this one. And then MTN will support. Samsung supports COVID-19 in Ghana. Donation of 500 units of Samsung Galaxy A2 Core to the government of Ghana with 6 months free data from MTN, supported by MTN. MTN and Samsung, we're very grateful to you. Very, very grateful. Very grateful. Thank you very much. Thank you very much. Distinguished guests, ladies and gentlemen, I want to invite Caroline Anipa of DUBAWA to give us some remarks on misinformation, disinformation, fake news, and how they are helping the general public validate the kind or verify the kind of information you are receiving on your phones or your tablets so that you are not misled as we fight COVID-19.
Thank you, Minister. So DUBAWA is a fact-checking organization that recently launched here in Ghana. We have offices both here in Ghana and also in Nigeria. So we've been in operation since February of this month. And over the period since we recorded COVID-19 cases here in Ghana, we've seen a lot of misinformation around the disease. And we've also noticed a trend, a pattern in the kinds of information that we see on social media and sometimes on mainstream media. We've identified that there's usually denial, the trend, we see denials of the existence of COVID-19 in Ghana. And we've also seen instances where there's of misinformation around COVID-19 cures and their remedies. So we've had instances where people have said Sobolo can cure COVID-19. We've seen cases where people say using a bowl of garlic, ginger, inhaling steam, and having constant sex can cure COVID-19. We've also seen cases where old pictures, videos have been taken out of context and are presented as if they are incidents that have happened or are currently happened. So during the lockdown period, sometime in March, we saw a lot of videos of brutalities in other parts of the world. One was of police brutalities in Zimbabwe, which were taken out of context to mean that there were things that were currently happening because of COVID-19, and that the government of Ghana should also apply to ensure that people obey directives of government. And then also we see a lot of internet scams because, you know, we are not in normal times. People are having financial challenges, people have been laid off. So we see scams, promos, asking people to click on links or apply for dual jobs. And then there have been a lot of conspiracy theories all around COVID-19 as to even if it exists, whose fault is it? What's the origin of the disease in the first place? So we've seen all sort of misinformation circulating on social media especially. So how can we distinguish real news, real information from false information in spite of all the barrage of fake news and misinformation we are seeing on social media? So I'm going to run you through a few tips that you can use. The very first thing I want to say is that when you receive information on your tablets, on your phones, on your computer, or wherever it is, do not immediately share, especially if it invokes in you strong emotions like fear, anger. Those are ploys that fake news creators use to get you to share their content. And once you share their content, it gains traction. Once they gain traction, they're able to earn money out of it. So do not share immediately. Just relax a little and ponder over the information you've just received. Also read beyond the headline or the lead of the story, the first line. Those they are what gets you attracted to a story in the first place. So for fake news creators, based on this, so they use sensational headlines, which are clickbait, to get you to read or share their content. So read beyond the headline. So recently we've seen headlines like Mahama arrested for defiling 3 girls. That's a sensational headline. We know there is one Mahama, and you want to know if he's really the one. So you sometimes people just go away without reading beyond it. So read beyond it so that you have the full story, then you know what the entire story is about. And then also question the source of information. If it's a website that is sharing the information on social media, go to the About Us section or the Contact Us section to know more about it. Know the kind of content they produce. Are they credible content? Is this something you'd want to rely on? Or are they just a satirical website trying to create fun? So know a little more about the website or the source of the information. Also check the byline of stories you see on social media. Who is writing the story? Are they also credible? Do they mention the source of information? Do they tell you who is telling them, who gave the information they are sharing to you on social media? And also beware of posts or messages you get that do not mention a specific person. So you receive messages that say a friend's brother or a health expert in China, or there is one particular name you see, DJ Raoul. You don't even know if the person is real or not. So question the source of information and the author of the information you're getting. Attention to dates. We've seen, like I mentioned earlier, we've seen a lot of posts that have been rehashed, or posts that have been rehashed to mean as if they're things that are currently happening. So check dates. Check dates is very important because they are used out of context. And then pay attention to the writing and format. We see information that is purported to be coming from government agents, but ask yourself, is the government agency going to be using slang, pidgin in their write-up to you? Are they going to be making a lot of spelling and grammatical errors? So that's a telltale sign that information you're coming across may be false. Sometimes also we have fake news creators that have invested a lot in what they're doing, so they are less bound to make mistakes like grammatical errors and then the spelling errors you're talking about. So for those kinds of posts that you see on social media, read beyond what is in the post, and then look out for people's comments under the post. Some of us are on social media and we are defining people. So when we see something that is false, we sometimes call them out. So read beyond the post, know what other people are saying about it, and that can be your cue as to telling whether the post is true or not. And then also we should have, should I say, a sense of humor. Sometimes some posts are just jokes, but because we are able to tell whether they are jokes or not, we just take them as such. So know if it's a joke or not. Study the tone of the post, and also read about the page that's sharing the information, because if it's a page that shares jokes or satire, you're bound to see a lot of that on their website. And we are also content creators to help us identify jokes from real news. You can do this just by labeling your post satire or parody to help people distinguish between the two. Like I said, we see a lot of videos and then images also on our social media platforms. These are sometimes a bit tricky to distinguish whether they're real or not. Some of the things you can do to tell them apart is to look at the visual cues, look at odd body parts, look at the weather in the videos, look out for street names, signs, and then also what other people are saying about the photo or the video online. You can also use very simple digital tools like Google reverse image search, and then TinEye. They aren't very difficult to use. So for those of us who are digitally inclined, you can just Google them and try to see if they would be of help. Sometimes also we see websites shared on social media, and you see URLs and links that are a bit phony or they look alike. That is because fake news websites just tweak websites of authentic media organizations and then send them as if they're really true. So look out for phone and then look alike websites. For instance, you can have a website of graphic.com.gh, and then someone just changes the I in graphic to 1. So look out for those, and then you'd be able to tell. And the last thing I want to talk about is verifying with credible sources, multiple sources. If you're not sure about the information you're receiving, you can contact credible sources. We have mainstream media. You can also contact fact-checking organizations. You can get in touch with DUBAWA if you're not sure the information you have on your phone or your tablet right. So you can contact us on WhatsApp 542-818189 or on our social media platforms at DUBAWA. Thank you.
Thank you, Caroline, for those quick tips. I'm going to invite my colleagues to set up the microphone so that we can take your questions and provide quick responses at this moment. So if you have questions, now is a good time to step forward. Any takers? Or we are closing early today? Okay, one. Any others? Yes, madam. Are there any others?
Please, can I? My name is Sarah Paku. I want to find out if the Director General can help me distinguish between people who have died from COVID and people who have died of COVID. And also... I'm
sorry. People who have died?
Yes, we heard a health expert saying some of the persons died from COVID, while others have also died with COVID. Yes.
Okay,
so if
the COVID-related deaths.
Yes,
and
please.
then COVID caused death. Okay, go ahead.
Okay, and you also mentioned the fact that you witnessed some of the situations happening at the polling center. People are disregarding social distancing protocols. Apart from the appeal to them, is there anything that you would expect the EC officials or security agencies do to ensure they are there? Because it is quite serious at the places we have visited this morning, even before coming here. So.
Thank you, Sarah. Are there any other takers? Or should we wrap up after Sarah? Any other takers? Doc, I think this will be the only question for you this morning.
Thank you very much. Yes, we have COVID-related and those who die with COVID. We currently, the figures we give you don't distinguish the two because the global definition is that. But we have people in our books who had very severe metastatic cancer who also had COVID. But we add them as part of our cases. We have people who have had very severe, bad, decompensated heart conditions and this and that. But we still, within our own analysis, we are able to tease out these are people who probably would have died anyway. But because we have COVID, we still add them. So we really have, at all the 112, we have some, and there are some ones who had no comorbidity who died. We can also have a comorbidity, but exacerbated by the COVID. But you can also have people who have severely decompensated. They just happen to have But by the current definition, and because of the trends we are trying to study, grouped all of them as COVID death. And so that's what we have. Well, as I mentioned, we are in all gatherings, we expect that people will wear their masks, wash their hands, and most importantly, adhere to the social distancing protocol. What we have done with EC and our people to ensure this is done. What I've also noticed in the morning is that people queue before the event starts. And so that is where we are appealing to people that even before people come to tell them, they themselves must ensure that social distancing is taking place. I said I had 3 queues. The 3rd queue, they had clearly observed the social distancing, even though there was nobody there to tell them what to do. And that's why we are also using the opportunity to appeal to our opinion leaders in the community, our traditional rulers, to also play part in ensuring that these protocols are observed at all events, irrespective of what you do. As long as there's gathering, please make sure, just like we are sitting spread, I think we should all respect that, and that will help us. And it becomes part of it. You don't now make slips. You can get this virus by just a little slip, by touching where you're not supposed to touch, or touching something and accidentally putting your hands in your eye or nose. And so that's how we expect that the hand sanitizers, the mask wearing, and social distancing must be fully respected. So we will continue working with them. Like I said, we will use this opportunity to spread the COVID message, the health messages in the next 6 weeks as they are there to also help people live their adherence. The spread is there, but they are increased. And so if our opinion leaders and community, especially our chiefs, assist in those communities where we are having surges, I think they will make a long way in making sure people apply the protocols and adhere to the protocols at all stages. Honorable Minister, that's my response. Thank you.
Well, thank you, Dr. Abuaji. Thank you, Samsung and MTN. Thank you, DUBAWA. What's the site address again, DUBAWA? Ghana.dubawa.gh. You can verify the kinds of information that is out there on social, and also fact check some of the data that is being put out there. We want to thank you for attending upon our invitation this morning. God willing, on Thursday morning, we'll wrap up for this week. Thank you so much.
It's live on Joy News. My name is Daniel Dazi. So we just came back from the Information Ministry, where the Minister Kojo Ponkoma just closed today's press briefing. So it was a very short one. It actually began with the Director General for the Ghana Health Service, Dr. Patrick Kuma Abuaji, who mentioned that the case count has risen from 17,385 cases, as announced by the President on Sunday, to 17,741 cases. That means that the case positivity rate, as per the number of tests that are being carried out, which is now over 297,000, is now 5.96%, nearly 6%. Now, it's important that we throw light on this, because experts say as soon as the case positivity rate crosses the 5% threshold, it means that pool testing is not advisable anymore. And I think that one of the issues that will be discussed going forward will be how this new case positivity rate should change the way we are treating this disease in the country, the way we are testing, whether contact tracing would even be used going forward, and a number of other issues will come out as a result. But you're still live here on Joy News Desk with me, Daniel Dazi. We're going to begin in just a moment. Stay with us.